we presented the data of the CRYSTAL study, a retrospective analysis looking at the role of sidedness in the outcome. And we looked in the patients with a RAS wild type tumor, left versus right, and the distinction was made at the splenic flexure. Everything distal is left, everything proximal of the splenic flexure is a right-sided tumor. And what we found essentially is that left-sided tumors have a clearly better prognosis than right-sided tumors in the CRYSTAL study, whether that's in the group of patients treated with FOLFIRI cetuximab or FOLFIRI. Left-sided tumors do always better, and when looking at the different endpoints being progression-free survival and overall and response rate in the study. Regarding the predictive value, that's a bit more difficult. Left-sided tumors clearly benefited from cetuximab, while this was not in a significant way the case for right-sided tumors. There was a small numerical advantage in right-sided tumors for cetuximab FOLFIRI versus FOLFIRI, but this difference was not significant and the sample size was very small. So we can clearly say as a conclusion that this analysis showed that left-sided tumors have a much better prognosis than right-sided tumors, and that left-sided tumors benefit from cetuximab in combination with FOLFIRI compared to FOLFIRI alone, which was not clearly the case for right-sided tumors. And that was in the symposium, the tone also for the different studies, the different presentations that were given, and also the conclusion of the different discussions at this very important session. Well, in the field of left-sided and sidedness, what is important is that we are starting to understand that sidedness is not the only thing that matters. Sidedness is a surrogate for markers. There is on one hand, in the right-sided tumors are clearly more BRAF mutant tumors than on the left side. And this for sure explains partly the findings, but doesn't explain completely the findings. There were many other factors that have still to be unraveled or have to be settled that clearly influence. And that's going to be an important strategy for the future, an important topic also to do research, that not all colorectal cancers are the same, and that we have to correlate that also with the consensus molecular subtypes and to understand the different subtypes in the taxonomy of colorectal cancer. And that's, the evolution is going fast, but that's going to be implemented in the near future, and that's a way of new research, as well as, but that was not the topic of the symposium also, the role of checkpoint inhibitors in colorectal cancer, MSI tumors, where there's a clear benefit of the anti-PD antibodies, while that's not the case in microsatellite stable, the MSS tumors. One of the topics of further research is also to try to look to expand the potentially the population of MSS tumors that may be potentially candidates for checkpoint inhibitors. An example for that is, for instance, the trials that have now started with cobimetinib, a MEK inhibitor, plus atezolizumab, which seems to retrieve a bit more lymphocytes in the MSS tumors, so that they can potentially be also, some of these patients at least, candidates for checkpoint inhibitors in combination with the MEK inhibitor. So that's one of the examples of further research. So it's exciting times, and this ESMO was a great meeting also for that in this regard.